Good morning, everyone, and welcome to today's events Unrevealing the Mystery with Forensic Experience, organized by Shivi Forensics. And my name is Sri, and I will be your host for the session. We are thrilled to have you all here for an insightful discussion on the intriguing topic Understanding Thanatology, the science of death and time. Thanatology is the study of death and the processes associated with the play a crucial role in forensic science, helping us unravel mysteries surrounding mortality and its implications. Today's student speaker is Miss Anjali Singh. She is pursuing her MSc in Forensic Science from Jharkhand Raksha Shakti University. She will guide us through the fascinating world of thanatology, shedding lights on its significance in forensic investigations. I now invite Ms. Anjali Singh to take the stage and share her knowledge. After the presentation, we will open the floor for questions and discussions. Feel free to engage and clarify your doubts regarding thanatology and its application in forensic science. Thank you, and let's make this session informative and engaging.
Thank you, Shreya. Am I audible?
Yes, ma'am.
So, good morning, everyone. My name is Anjali Singh, and currently I'm pursuing my master's in forensic science from Jharkhand Raksha Shakti University. So, today I'm going to present on thanatology, which is a very interesting and a vast field, as we all know. So, that deals with the scientific study of death and the changes that follow it. So thanatology itself a multidisciplinary subject, which include forensic science, then pathology, sociology, theology, and spirituality as well. So this is a very broad subject, and I have tried to summarize it in a very concise manner. I hope you all will connect it as we go through our presentation. So I am going to present my screen. Is it visible to all?
Yes, ma'am.
Yes, ma'am.
Okay. So these are the contents of our today's presentation. That is, what is thanatology? That means what the meaning of thanatology and core dimension of thanatology. That is the core significance of thanatology in the context of forensic investigation, and then concept of death and life, types of death, somatic death, and then transplantation, mechanism of death, manner of death, signs of death, suspended animation, and then what are the early changes during the death. That includes algor mortis, livor mortis, rigor mortis, and then cadaveric spasm, decomposition, adipocera, mummification, and euthanasia and afterlife. So, thanatology derived from the Greek word thanatos, that means death, and logy means study of. So, this is a systematic study of death and its accompanying phenomena. So, death is not a event. Okay, death is not an event. This is a process. So, the core dimension of thanatology in forensic investigation, that is the significance of thanatology, that is determination of death. Determination of death means we can differentiate by examining the dead body that whether it is an apparent death or a true death. What does it mean by apparent death? Apparent death means irreversible sign of death. In case of like suspended animation, we can found such kind of reversible, reversible cessation of life. That is the tripod of life. Then PMI, postmortem interval estimation of time since death. We can analyze the time since death by analysis of algor mortis, that is the body cooling, and rigor mortis, muscle stiffening, and livor mortis, that is postmortem hypostasis. So Then postmortem changes that include early changes and late changes. Then manner of death. Manner of death means the fashion of circumstances of the death. What are the whether it is a natural, accidental, or suicidal. So this include manner of death. Now, before dive into death, can anyone tell me what is the meaning of life? What is the definition of life? Anyone? What is the definition of life? So, well, life is the state in which an organism shows vital functions that keep it alive. And in case of death, it is an irreversible cessation of permanent, permanent cessation of irreversible process. That is the vital of the, that is the of our organ system, that is remain irreversible cessation. Okay. So different, there are different definition regarding death, that is philosophical context, where the Oxford Dictionary gives the meaning of death, and then Chambers 20th century, then Black's Law Dictionary, and then legal context. So in India, death is legally defined under the Registration of Births and Deaths Act, that states as permanent disappearance of Yuvraj, death, complete seizure of tripod of life. Yeah. So death is legally defined under the Registration of Births and Deaths Act, that is the permanent disappearance of all the evidence of life at any time after live birth has taken place. And the Transplantation of Human Organs Act, that also recognizes brainstem death as a form of legal death. So what does it mean by brainstem death? Brainstem death means the lower part of the brain that connects the cerebellum to the spinal cord. Okay, brainstem that include our midbrain, then pons, then medulla oblongata, and this brainstem controls our breathing, heart rate regulation, and all the reflexes. So when our brainstem, when the brainstem death, this leads to death as a legal form. Okay, then medical context, like medical context, the permanent irreversible cessation of circulatory and respiratory functions, as I have mentioned, that is the tripod of life. So that considered in the medical context, that is the death. Then types of death. So types of death, that is the two types of death we have found. Death is that is somatic death, that is systematic death, and then molecular death, that is the cellular death. Somatic death means the death of whole body. Okay, so somatic death marks the end of life of the individual, and in case of molecular death, it is the death of the cells that continues even after the person is declared dead. Okay, then apparent death. So apparent death or suspended animation, which is condition where the vital functions are so minimal that a person appears dead. Okay, but life persists and is reversible. So death is, we all know, in case of true death, it is a irreversible process, but in case of apparent death, it is a reversible process. And then okay, what is the example of the apparent death? In case of, we found apparent death in the case of drowning and then drug overdose or hypothermia. Then sudden death, that is irreversible. Okay, sudden death, that is unexpected death occurring rapidly. Okay, that is usually 24 hours of onset of symptoms. Okay, in case of cardiac arrest, stroke, or internal breathing, that leads to sudden death, that is irreversible. And then brain death. Brain death is like, it is also irreversible, and it is the irreversible cessation of all the functions of brain, including brainstem death. That is that includes no brainstem reflexes, no spontaneous breathing. Okay, as I have mentioned earlier, that is, it is legally accepted as death. Okay, and then instantaneous death, that is also irreversible, that where death that occurs immediately at the moment of injury or event. In case of decapitation, like जब बॉडी से जब हेड को अगर अलग किया जाता है, in case of sudden injury or event, that is called instantaneous death, that is irreversible process. Or severe brain trauma or massive cardiac rupture, that cause leads to instantaneous death. Now, somatic death and transplantation. Somatic death is also known as clinical death. It is the process or the cessation of cardiac and respiratory functions. That is the tripod of life, cessation of the tripod of life. While transplantation requires rapid actions, often within hours. So, what does it mean by transplantation? Transplantation means the surgical transfer of cells, tissues, or organs from one side to another, or from one individual to another, to restore the normal functions of life. Okay, so these are the key timelines for organ transplantation. That is, for heart and lungs, it requires 4 to 6 hours, and then liver 6 to 12 hours, and these are pancreas and kidneys. These times are required for transplantation. Okay, so in case of somatic death, when the brainstem death, that is called impairment of central nervous system function, that's called coma. Asphyxia, that is the stoppage of irrigation function, and stoppage of function of heart and circulation, that is called Singh. So these are the signs for somatic death. Now, types of transplant. First is autograft. So autograft, that is the transplantation process where the that is the part of one part of the body is transferred to the another part of same individual. Okay, like skin grafting. Okay, here no immune rejection rejection is required. Then allograft. In case of allograft, between two individuals, it happens between two individuals of the same species. It is a very common type of transplantation process where it requires immunosuppressive drugs. So, example like kidney transplantation. Then isograft. Isograft is happen between genetically identical individuals. In case of identical twins, we found isograft. Okay, and then xenograft. That is, it happens between two species. That is where we example, that is where we transfer the pig heart to a human species or another species. That is called. It happens it has a higher rejection rates. Okay, and then split transplants. That is, it is a surgical division of a donor organ into two patients. Okay, like if we are like example, if one donor liver can be split into if the donor liver can be split into the left lateral segment for a child and the right lobe for an adult. Okay, so these are the example of split transplantation. Now, mechanism of death. Mechanism of death means the physiological and biochemical processes that induced by the cause of death. That leads to the irreversible failure of vital functions. So what is the cause of death? That is any specific disease, injury, or condition that directly initiate the chain of events that leading to death. So first is exsanguination, that is the hemorrhage. That is in case of severe blood loss that leading to the hypovolemic shock. Okay, and that results in multi-organ failure or the cardiac arrest. In case of coma and brain death, so we all know coma is a very unarousable and unresponsiveness condition where it presents. Coma represent the severe terminal dysfunction of the brain's ability to maintain vital functions. So coma leads to it serves as a physiological pathway or mechanism may progress as a brain death. And then sepsis or toxemia. Sepsis or toxemia, that is when the infection enters the bloodstream that causes the systematic inflammatory response. Okay, so when any kind of infectious agents that enters into the bloodstream, then they release any kind of toxins or cytokines, and that leads to septic shock or organ dysfunctions. And then cardiac arrhythmia, ventricular fibrillation. As we all know, heart beats in a very coordinated electrical pattern. So in case of ventricular fibrillation, electric signals become chaotic and disorganized, and this leads to cardiac arrhythmia where no contraction happens. And then asphyxia. Asphyxia refers to the condition where the body deprived of oxygen. Okay, so due to any kind of obstruction of any of airway, that is in case of choking or smothering, or in case of compression of the neck structure, that is in case of hanging or strangulation, where asphyxia happen, and that leads to the death. And then manner of death. Manner of death means the fashion of circumstances of the death. That means whether it is natural, unnatural, or obscure. Natural means the natural way of death, that is the cessation of the tripod of life. Then unnatural, whether it is a homicide, suicide, or accidental. Then obscure. Obscure means the reason is not found. Okay. If a dead body has found, but there no sign in injury and all, so this kind of cases that called obscure. Now, signs of death. So signs of death, that is immediate signs of death, that called somatic death, and then early, that is molecular death, and that late changes or decomposition phase. So in case of immediate or somatic death, here we use different kind of test. Okay, that is obsolete right now, that are not used right now, but these were used earlier, like Winslow test, feather test, or meter test, where if in case of like a feather test, where we place a feather on the nostril or upper lip. So if a person alive, the feather moves with inhalation or exhalation, so we can depict that yes, the person is alive. And in case of Miller test, where the condensation from exhaled air will appear on a cold surface. Okay, so in this case, we place a small mirror on or any kind of metallic plate under the nostril or the nose or the mouth. So if the fogging on the mirror be found, so we can say the person is alive. Okay, that is active respiration. That depicts the active respiration. Now, what are the immediate changes that is happen? That seconds to minutes after death. That first thing that we can found, that is muscle relaxed immediately, and then loss of consciousness, consciousness, and reflexes stops. Then pupil become dilated and become fixed, heart stops, blood stops flowing, and then skin become pale due to the blood draining from capillaries. So these are the immediate changes. That is the cessation of heart rate or respiration instant, then brain activity stops, and then loss of muscle tone. And pallor mortis, skin become pale, that is within 15 to 30 minutes. Pupils dilated and fixed, that is immediate changes of death. And in case of early changes, that is minutes to hours, livor mortis begins. That in case of livor mortis, where the blood settles in dependent areas. Okay, and this leads to purple or blue discolorization on the dead body. So livor mortis begins 20 to 30 minutes, and it fixes 6 to 12 hours. Then algor mortis. In case of algor mortis, the body starts cooling towards ambient temperature. So it starts within 1 to 2 hours after death. And then rigor mortis, that is called body stiffening, that starts within 2 to 6 hours, and it completes within 12 hours, and again disappears 24 to 48 hours. Sorry. So other changes, then corneal clouding within 2 to 3 hours, and then trachinoidy, that is 3 to 4 hours. But, and the third one is late changes, that happens hours to days or weeks. That is putrefaction, where it starts like 24 to 72 hours, and then advanced changes, adiposity, mummifications, that requires weeks to months. And then so these are the things. Marbling, skin slippage or blotting, these are the characteristics of late changes. Okay, so in marbling happens 24 to 48 hours, then skin slippage that happens 2 to 5 days, and then blotting 2 to 4 days. So I have already mentioned what are the immediate changes, early changes, and late changes. Now, suspended animation. So suspended animation, also known as apparent death, where it is a condition where a person appears dead, but he is actually alive. Okay, with a very minimal or undetectable vital signs like breathing, then heartbeat, then pulse rate, etc. So this is a reversible process. Okay, so this can be divided into two types, that is voluntary. It is seen in practitioners of yoga or in trance. Voluntary cases like poisoning with barbiturates or opiates, newborns, then cholera, heart stroke. In such type of cases, we can found suspended animation. Now, these early changes, that is called the molecular death. What are the characteristics of early changes? That skin become pale, ash white due to the stoppage of circulation. Then the skin loses its elasticity, and face eventually looks younger due to loss of traces. So there are different systematic changes in eyes also. So loss of corneal pupillary reflexes, intraocular tension falls rapidly after death. So it becomes 0 in 4 to 8 hours from 10 to 22 millimeter of mercury, okay, during life. So after death, our intraocular tension falls rapidly. The pupils are dilated after death, and then we can found trachinoidy, and the blood in the retinal vessels appears fragmented or segmented, cattle tracking, within seconds to minutes after death. And it persists for about an hour. That also known as Cabercan sign. So I have paste the image. This second one is known as the Cabercan sign or the cattle tracking, and the first one is the trachinoidy. So these are the type where we found in case of molecular death. These are the characteristics changes in eye. And these are the sequence. Postmortem changes. First pallor mortis, the skin becomes pale in color, and then algor mortis, the cooling stage. Heat is lost through the radiation, convection, conduction, and evaporation. And then rigor mortis, that is the stiffening stage, and then livor mortis, that is the discolorization of the skin. Now, cooling of the dead body. So we all know our normal body temperature around 37 degrees centigrade. So after that, our body start losing heat because there is no metabolism and heat lost in environment. So the rate of cooling, is average 1 to 1.5 degrees centigrade per hour. It happens first 12 hours, okay, and then it starts slow down, like approximate 0.5 to 1 degree centigrade per hour. So then body usually reaches its environmental temperature within 18 to 24 hours approximately. So I have mentioned here a graph that is the curve of cooling pattern, that is sigmoid and bi-exponential or inverted H-shape pattern. So stages of cooling, that is initial plateau phase where the temperature remains normal. Okay, then in linear fall phase, it starts decreasing or decline, and then in equilibrium phase, body reaches ambient temperature. So in dead body, we measure the temperature in rectum, where we use the instrument that is thanatometer or special thanatometer. This is the thermometer. Okay, special thermometer where we use for dead body. So the rough estimation of time since death, okay, is obtained by this formula. The formula is approximate time since death in hours equal to normal body temperature minus rectal temperature by rate of temperature fall per hour. So this is the calculation. This is the formula by which we can estimate the time since death. Then postmortem staining, that is livor mortis or hypostasis. So postmortem staining, these are the process. Okay, in early stages, it consists of discolored patches on the dependent parts of the body of 1 to 2 centimeter in the diameter. It is usually well developed within 4 hours or complete in 5 to 6 hours. So hypostasis, in the early stage we can found hypostasis, then lividity, established staining, and then contact pallor. Contact pallor means pale areas where the pressure blocks the blood settling. I have placed the image here. You can see the area of blanching or contact pallor, and this is the cherry purple color, that is the livor mortis, that is the staining pattern. Now color variation. These are the conditions where the color can be varied. In case of carbon monoxide poisoning, it can be found cherry red color. Then cyanide poisoning, it can be found chocolate brown. And then for hypothermia drowning cases, it can found postmortem staining as pink color. Then deep bluish or violet for asphyxia. Then rigor mortis. So rigor mortis happened due to the ATP depletion. Okay, due to the breakdown of ATP of muscles. So these are the rigor mortis, that is Latin word that tells about the stiffness of death. It is the state where the muscles in dead body when they become stiff or rigid with some degree of shortening. So rigor mortis, first comes primary relaxation, then rigor mortis, then secondary relaxations. So Newton's law that depicts that the rigor mortis affects first the muscles of jaw. So rigor mortis first starts from the involuntary muscles, then voluntary muscle. Okay. So I have mentioned here that involuntary smooth muscles, we can found the rigor mortis first, and then voluntary or striated muscles. Then rule of 12. So in case of rigor mortis, there is a rule, that is rule of 12. In tropical countries like India, roughly it commences in, rigor mortis commences in 1 to 2 hours after death, and then it takes about 9 to 12 hours to develop, and then it persists for another 12 hours and takes 12 hours to pass off. So here I have pasted an image. We all know in case of normal muscle physiology, muscle contract and relax using ATP. Okay, that is the energy. Adenosine triphosphate. So myosin and actin, that is the muscle fibers that works together for the muscle contraction. So myosin heads attached to actin, and it leads to contraction, and then ATP binds and detachment happen, and then it happens relaxations. Okay, but in case of death, in case of death, we know there is no oxygen, and there is no production of ATP. So without ATP, muscles cannot relax. So in case of when the death happen, calcium membrane become leaky. Okay, and then calcium releases from sarcoplasmic reticulum, and this calcium activates the actin myosin binding, and then again myosin head bind tightly to the actin, and as there is no ATP, so they cannot be detached, and that leads to permanent contraction. And in case of secondary relaxation, it happens due to the gradual disappear due to the autolysis and enzymatic degradation of muscle protein. Okay, primary relaxation happened due to the depletion of ATP, and secondary relaxation happened due to the enzymatic degradation of the muscle protein. What are the muscle protein? That is actin and myosin. Now, these are the timelines, how it appears and how it disappears, and then factors affecting the rigor mortis. That is environmental temperature. So in environmental temperature, in case like high temperature, rigor mortis starts earlier, and then in case of low temperature, we found delay rigor mortis. And then muscular activity like exercise, struggle, or any excess activity that leads to like use of excess ATP. So here rigor mortis comes first. Or in any rested body, or the person cannot exercise, or and all those things. So here rigor mortis develops slowly. Then age, that is for children, they have very less muscle mass. So here rigor mortis, we found the rapid onset rigor mortis. And then body build, like thin body, we found earlier rigor mortis. Muscular body, we found delayed rigor mortis. So if rigor mortis does not develop in a fetus of less than 7 months of intrauterine age, it is moderate in children and hematopoietic and in elderly people. And this is the time for rigor mortis. Early 2 to 6 hours, rigor mortis begins. First eyelids, and then jaw, and then the full body. Then after 2 hours, it appears. Then center of the body stiffens, and then 12 hours it fixes complete rigor mortis. That is the entire body repeat. And after 36 to 40 hours, rigor mortis disappears. That means muscles become relaxed. So these are the temperature in the development of rigor mortis. Okay, if the body feels warm and flaccid, that means we can estimate time since death, that is death less than 3 hours. If the body feels warm and is stiff, then death is from 3 to 8 hours. And then these are the conditions that if the body feels cold and flashy, that death more than 36 hours. So these are the condition of the body by which we can estimate the time since death. Now, cadaveric spasm. That is instantaneous rigor or rigidity, that is cataleptic rigidity. That is completely different from rigor mortis. Here, it is an instant ATP depletion. In case of rigor mortis, this is a delayed ATP depletion. But cadaveric spasm, it is an instant ATP depletion. It occurs especially in cases of sudden death, excitement, fear, or severe pain. Where it occurs due to the sudden extreme condition at the time of death, leading to instant ATP depletion. So, instant fear that leads to nervous system overreact, and then it leads to sudden muscle contraction. Okay, it happens like in case of drowning people when the victim tries to grasp any object. Here I have placed this image. You can see the cadaveric spasm. The person grabs any object, grabs the object. So the rigidity found in the case of at that moment. Then cadaveric spasm also divided into 3 parts. That is heat stiffening, cold stiffening, and gas stiffening. In case of heat stiffening, if the body is subject to exposure at more than 65 degrees centigrade, then the rigidity is produced. And then cold stiffening is found in if the body exposed to the freezing temperature, and for gas stiffening occurs during putrefaction. Okay, due to the accumulation of gas in the tissues, which causes false rigidity, resulting in stiff limbs, and is very obvious from the discoloration, swelling, and the foul smell. And the late changes, that is decomposition or putrefaction. So this is the process where when the body after death, it happens due to the action of bacteria and the enzymes that resulting in breakdown of tissue and the formation of gases and along with smell. Okay. So after that, what happened? Immune system stopped, and then bacteria started to multiply, and then they break down our proteins, and these proteins produce breakdown proteins. So in this process, different gases were produced, like H2S, that is hydrogen sulfide, then methane, then ammonia, and along with foul smelling also found there. So the key characteristics of decomposition or putrefaction, that is marbling of skin, that is bacteria produce hydrogen sulfide, reacts with hemoglobin, and then it forms sulfur hemoglobin, and then this causes discolorization along blood vessels, form linear branching patterns. So these are the linear branching patterns in case of marbling of skin. Then postmortem luminescence. This is the also characteristics in case of decomposition or putrefaction. It is usually due to the contamination by bacteria, like Photobacterium piceri. During the putrefaction, bacteria and microorganisms break down tissue, and some microbes produce bioluminescent compounds. And this bioluminescence chemical reaction may emit low intensity of light, that is called postmortem luminescence. Then internal changes due to putrefaction, that we can see the internal changes in case in the liver. Liver, we found the honeycomb appearance due to the formation of air bubbles. It becomes greenish in color and later changes to cold black. And then in case of heart, we may show white granularity consisting of calcium and soapy material on epicardial and endocardial surfaces. This is known as military plaques. Okay. In heart, we found military plates. Then prostate and uterus being the last organ to decompose, and they help to identify the sex of the dead bodies in advanced state of decomposition. Then pink teeth in putrefied bodies, the teeth becomes like pink in color, especially near the gum line, and this result as a result of hemolysis of extra vascular blood in the dental tubules. This happens. So these are the order of putrefaction. This is the early putrefaction found in larynx, stomach, spleen, liver, and then late putrefaction, heart, esophagus, blood, bladder, etc. Then adipocera and saponification. So adipocera and saponification, this is the postmortem changes where the body fat is converted into a waxy and soap-like substance. So why this is happens due to the hydrolysis and hydrogenation of fats. Okay. So after that, our body fat started to break down into fatty acid and glycerol, and this fatty acid combines with minerals like calcium, then magnesium, and then it forms a soap-like substance, and this is called adipocera. Okay. So time required for formation in hot and moist environment, it may occur by the end of 1 week and earliest recorded 3 days. In temperature countries, it starts in 3 weeks and completes in about 3 months. Then mummification. Mummification is a process that is the rapid dehydration and desiccation and the shriveling of the dead body from evaporation of water with preservation of natural appearances and features of the body. It is also called as modification of putrefaction. So the entire body loses weight, become thin and stiff and brittle and odorless. So this process of normal decomposition of the dead body is prevented as the growth of the microorganisms is retarded. The time required for mummification is between 3 to 12 months or longer. So after that, what happens? Rapid loss of water, rapid loss of water can happen from the tissue. Okay. So in the dry condition, we all know bacteria cannot grow. So in this case, decomposition become delayed and the body gets preserved, and this preserved condition is known as mummification. Now, euthanasia, that is a very interesting term. That means the intentionally ending a person's life to relieve suffering from an incurable or any painful conditions. Okay. As we know, legal recognized by the Supreme Court, passive euthanasia. There's 2 types of euthanasia. That is active and passive. Passive euthanasia, legal recognized by the Supreme Court of India under Article 21, right to life with dignity. Okay. So this may be voluntary or involuntary and carried out with or without a physician. Okay. In a medical environment, it is normally carried out by a oral, intravenous, or intramuscular drug administration. So recent there is a case that is recent there is a case that is Hari's Rana that took place in AIIMS Delhi on March 24, 2026, where the euthanasia happened, and then afterlife, that is this is a very spiritual context. Like many cultures and past and the present have had some belief in an afterlife. So such beliefs are usually manifested in religion as they pertain to phenomena beyond the ordinary experience of the natural world. So this is not scientifically any existence and all. Nothing has ever been proven about either the existence or nature of an afterlife. So the topic remains highly speculative. Now the estimation of time since death, that is post-mortem interval. So it refers to the determining the interval between the occurrence of the death and the discovery of the body. using postmortem changes and scientific methods. So how we can estimate postmortem interval, estimate that by analysis algor Mortis, that is the gradual fall in body temperature after death. That is, we all know after per hour it falls like 0.5 to 1 degree centigrade in early postmortem period, first 24 hours. Then by analyzing like postmortem staining, that is liver Mortis, settling of blood independent parts help to estimate the time since death, and along with the position of the body. Okay, from the liver Mortis we can estimate the position of the body as well. And then rigor mortis was stiffening of the muscles due to the ATP depletion, and it begins 2 to 4 hours, and then it complete 6 to 12 hours, and again it disappears 24 to 48 hours. Then by analyzing food refraction, along with the characteristics like marbling, blotting indicates late PMI. Then chemical method that is known as thanatochemistry, that is vitreous potash level that increase with temperature. Then biochemical any changes. Then forensic entomology, this is another topic which also helps to determine the postmortem interval or advanced decomposition state, in the advanced decomposition state. And then modern techniques includes molecular method, that is RNA degradation, microbial clock, that is microbiome changes, AI-based predictive models. This all helps in estimating postmortem interval, that is known as time since death. So I have given here some MCQ. So please answer this. So the first question is earliest postmortem change. Where we found the earliest postmortem change? Then the second question is sequence of rigor mortis. What are the sequence? And then contact pallor is seen due to which condition? And then question number 4, which condition favors adipocere formation? And 5, mummification occurs in which conditions? And then 6 is cadaveric spasm differs from rigor mortis because what is the reason? Please try to solve these MCQs. You can write it down in the chat box also and drop your answers in the chat box. Divesh, Sangeeta. It's me. So the earliest postmortem change is rigor mortis, liver mortis, algor mortis, pallor mortis. One is D. Yes, D is right. And then 2, sequence of rigor mortis follows. Legs, trunk, face, trunk, legs, face, trunk, limbs, and limbs, face, trunk. Yes, 2. C, correct answer. And then contact pallor is seen due to increased blood flow. Yes, right answer. Shreya. Divesh. Yeah. Contact pallor is seen due to the pressure preventing blood settling. And then 4, which condition favors? Yes, right answer. Which condition favors adipocere formation? Yes, right answer. C, option C, that is moist anaerobic environment. And then 5th question, that is mummification occurs in 5B. Yes, right answer. Dry and hot conditions. And then cadaveric spasm differs from rigor mortis because 6C. Yes. So it occurs immediately after death. Yes, right answer. So I am moving forward to the answer. Yes, right answer. So is that the answers? So thank you everyone for hearing me throughout the session. Thank you, Shivi Forensics, for providing me the platform for sharing my knowledge. Thank you all.
Thank you, Ms. Anjali Singh, for your enlightening presentation. We appreciate your efforts in sharing valuable insights into thanatology. And thank you to all participants for being part of this event by Shivi Forensics. Remember, student, to fill the attendance link to mark your presence to receive your e-certificates. Thank you.